So we're going to be watching fluids and electrolytes with these folks. We're going to encourage them to take their diuretics in the morning. That prevents them from having to get up in the middle of the night to go to the bathroom. We're going to be monitoring serum potassium levels. And potassium supplements are not usually recommended unless their levels drop below 3 milliequivalents per liter. But we're going to teach them the importance of nutrition and fluid volume. And we're going to tell them what foods have potassium, and that unless they're taking a potassium-sparing drug, they should be eating more of these high potassium foods, such as bananas and orange juice. Those are the two that you hear people talk about all the time. But it also includes dates, raisins, plums, apricots, fresh vegetables, potatoes, legumes, meat, fish, whole grain cereals. Doesn't this sound like just our plain old good, nutritious diet? Signs and symptoms of hypokalemia include muscle weakness. Muscle weakness is one of the first things people complain of. There's also constipation. Well, if your muscles are weak, that includes the muscles of peristalsis, right? Irregular pulse rate, you got a weak heart, and an overall feeling of lethargy. Patients taking diuretics should be taught to monitor for digitalis toxicity, and people with diabetes should be watching their blood sugar especially close. We're going to teach them all the safety things surrounding postural and orthostatic hypotension. Get up slowly. Don't suddenly jump out of bed. Take it a step at a time. We're going to encourage people on these drugs to weigh themselves daily. If they gain 2 or more pounds a day or 5 or more pounds a week, they need to be contacting their health care provider immediately. And they need to be getting periodic lab work. Now, if they've been ill with nausea, vomiting, or diarrhea, we're worried about fluid loss, and that's going to interfere with these drugs. If they're dehydrated because they're sick, and then we're adding these medications on top of them, we could end up with some potentially serious problems. But the other issue is, if they're losing all this stuff, they're also losing potassium. So we're doubly concerned about potassium levels. We're going to have them call their healthcare provider immediately for rapid heart rates or syncope. Excessive consumption of licorice can lead to more hypokalemia in those who are taking thiazides. And we're going to be watching for metabolic alkalosis, drowsiness, lethargy, hypokalemia, tachycardia, hypotension, leg cramps, restlessness, decreased mental alertness, all of these. We're going to be watching for hyperkalemia with the potassium-sparing diuretics. And finally, if these drugs are working, we should see decreased edema. We should see decreased fluid volume overload, decreased problems with heart failure. Blood pressure should be better.